in my experience as a former professional athlete, I did have some narcissistic behavior. Now later on in my career, and my career did end in a head injury. So, and I think that, there's a lot of talk about CTE in the NFL and NHL and boxing and the hits that we take to the head.
Drug-induced psychosis or drug-induced grandiosity. We have to involve the family and we have to involve the partner. You must be joking. I was at home. What are you talking about? I never asked you that you'll be happy this way. I never said that. So what are you going to do? If the gaslighting is there, how are you going to cause awareness?
Hi, I'm Joe Mesi, and you're watching Healthy Living with Baby Joe. Thank you for joining us. We've got a great segment this week with Dr. Sumit Grover. Thank you for joining us. Licensed psychologist, motivational speaker, and life coach, specializing in narcissism and personality disorders. And we are going to learn more from her in a moment. Thank you so much, Dr. Grover. Thank you for being here. Please tell us a little bit about your background and what led you here to Western New York.
Sure. Thank you very much for introducing me. Well, I completed my doctorate in psychology from United Kingdom, from University of Canterbury, David Salmon's institution. And then I was working there, got married to an American, and I moved here. My husband was an IT engineer. Family lives in Buffalo, so we decided to be here. And I'm practicing in my own clinic in a group, Grover Psychological, since past 15 years here at Maple Road.
Well, lucky you. Western New York's a wonderful community. And if you don't know, go to YouTube and subscribe to Dr. Sumit Grover for some very informative, very educational information, specializing in bipolar disorder, narcissism, borderline personality disorder, which we're going to dive into now. Doctor, what is the difference between narcissism, personality, and borderline personality disorder?
Sure. If you have attended a date, if you are dating, and the second date the person says, I love you, that's borderline personality disorder for sure, right? Getting into relationships quick and finding hard to maintain and sustain and coming out of relationships quick, that's borderline personality disorder. The main base being because they're insecure, fear of rejection, fear of abandonment. So for them, they're clingy and they will do manipulation to retain. That's borderline. Narcissism, narcissistic personality disorder is, I am the best. I am here on the pedestal. I have the power. I am going to control this relationship. You are going to be happy only the way I will ask you to be happy. So controlling other person's behaviors, emotions, and putting themselves on a high pedestal, belittling the other person, that's narcissism.
Why are these words being thrown around so much lately? Is there an increase in these disorders? I mean, what do you think is the purpose and the reason for that we're hearing about personality disorder and narcissism so much now?
Thank you to Dr. Google for that, because we all tend to go into research we all use. And then don't forget, COVID changed many things, right? When it was COVID, we all were online. We were trying to search what issues we have. And then even self-awareness. Right? We are living in the world of Genesis Z and now coming up Genesis Alpha. So the kids who are born and even Y, Genesis Y, they're all well equipped with these terms and with narcissism, with toxicity. Toxicity is a very common word. Oh, it's such a toxic relationship. So toxicity, where the toxicity is named, the personality disorders do enter in with that in any relationship. So that's why it's more commonly used.
Yeah. And what I love about you and your practice, this is non-medical treatment. So would you treat people as a couple? Do you treat them individually? And what type of therapies do you offer?
Dialectical behavior therapy. We do have good treatment for BDP, for borderline personality disorder. So BPD, sorry. So dialectical behavior therapy was a kind of a therapy which was introduced by Marsha Linham, and she's the founder. I count her as a founder. We all are trained through her. Mm-hmm. We all have trained ourselves reading and doing her courses and stuff. So If you are committed to do dialectical behavior therapy and mindfulness and learn mindfulness skills, you can be treated with borderline personality disorder. For narcissism, the treatment is absolutely different. It takes years and months together to cause self-awareness, because we need to understand gaslighting. Gaslighting is one of a very strong symptom of narcissistic personality disorder. And what is gaslighting? I never said that. You must be joking. I was at home. What are you talking about? I never asked you that you'll be happy this way. I never said that. So what are you going to do if the gaslighting is there? How are you going to cause awareness? Because they are delusional. They are making their own story. They don't want to face the reality.
What can you share with us? What type of effects is it taking on a relationship, a husband and wife, a mother, daughter, a son and mother? What type of effects is that doing to relationships?
Sure. If we are talking about personality disorders,
Yes.
As far as narcissism is concerned, it's very hard for the child. The child development can get messed up because of the reason, because the mother or the parent, they have certain expectations out of the child.
Sure.
They want the child to be exactly their ditto copy, and they want to control the relationship. So it's to the point that I know what will make you happy. You need to be this when you become an adult. You need to choose this path and this career. That will only make you happy. I know you better than you know yourself. Come on, you're telling a 22-year-old person that I know you better than you know yourself. It's a problem, right? So that's what it impacts into the development. Lack of confidence. For borderline, it's worst. It leads to confused.com child, because of the reason the mother or the parent is reacting to the same situation in a different way, because emotions, when are at height, they are dealing with the situation in a different way. When the emotions are low, they're dealing in a different way. So for the kid, for the child, oh my God, so how am I supposed to react in this situation? So the emotional development, it gets messed up with the child. It's very sad, but that is why when we have a patient with borderline personality disorder, we do try to involve the family and treat both of them together.
Yeah, I can see that could be beneficial. How would gaslighting play into effect with these disorders? I mean, it's got to be pretty common, right?
Yeah, gaslighting is more a symptom of narcissistic personality disorder, okay. And that is one of the reasons why it's very hard to cause awareness to the patient that you are going through narcissistic personality disorder and you need treatment, because the moment if for example, in my clinic, once it was a mother who came with the daughter, and the daughter is telling me that that is what she said and that's what she did. And it's completely gaslighting in the session. I never said that. Mm-hmm. No, you are mistaken. You must be dreaming. So for them, if they are not going to accept, and the gaslighting is there, because to be honest, I really have empathy and sympathy with people with narcissistic personality disorder, because they are not doing that deliberately. It's a disorder. We need to understand. So they're not gaslighting it just to play games there.
They believe it, right?
Yeah, they believe it. They believe it. For them, that's the reality.
So the challenge for you is, how do they get that, how do they express that to you, to open up and almost find admittance that they have to, yes, I do have this problem in your clinic? Is that a challenge for you?
In my practice, out of, if I've seen 100 patients with narcissistic personality disorder, their children and their partners have come and they have mentioned certain symptoms, and I do think they have narcissistic personality disorder. But in my clinic, it's rarely they will come. And even if they're at the point of accepting it, if they'll accept it, yes, I think, Dr. Grover, I do have narcissistic personality disorder, they will never come back for the second session.
Once identified, you have your work cut out for you?
They will not come back, because for them, you understand, because that mask,
yeah.
that public mask which they are wearing, that's very important for them. They can't drop that mask off, and by confiding even to a therapist, they are not liking that. For them, oh, she's a ridiculous psychologist, don't come back here.
It must be challenging for them to be able to put themselves in someone else's shoes. Let me look at this from your viewpoint for a minute, right? And it's hard for you to get them to have that point of view, maybe?
Yeah, of course, of course. It is very sad, even for me, because for me, the way I work in my clinic, I do not like any patient leaving my clinic untreated. Yeah. Because for me, I count treating them as my success. That is my passion. Right. I just want to tell you a very interesting thing here. Long time back, we had, Grover Psychological, we owned a building at 8600 Sheridan Drive. So we sold that building in 2017 after my husband passed away. So out there, early in the morning, there was a deer who crossed the Sheridan Drive road and was hit by a car. So the deer got injured, and when it reached our main door, the leg got stuck below. Oh. Right, and I had to call the animal people, and they came and they injected, and they said, Dr. Grover, we can't treat it, so it's better to put this deer to sleep. And they took the deer, and I cried. Oh, and everybody was surprised. Why are you crying? Because for me, anybody, any living creature who comes to my door of my clinic needs to be treated. I don't like it when they are left untreated and when they leave my clinic without treatment. So that's the way I work. So for me, it's very sad for me when I have to let them go, because there's nothing known as enforced treatment. You can get the horse to the water, but you can't make the horse drink the water.
Well, that's great. It's great that you practice that way, and it's very encouraging for us. But I think, and it's drsumitgrover.com, and she's on Maple Road, and you can get your consults at any time you wish. But I think social media, how does that factor in? Everybody now has a voice. Everyone now has an opinion. And we all have a microphone, and we want to be heard. Is that changing things for us to in the population of these disorders, or identifying these disorders? Yes,
yes, it is something. Are you talking about projecting your grandiosity on social media? Yes. And claiming yourself as a fake or a better person. Yes. So out here, yes, social media, like you see, everything, every new invention, it has its positives and negatives. Right. So if the social media has so much of positive things, like for COVID, we ran our therapy sessions through social media and through internet and through media, correct? But out here, and many people, especially in the United States of America, when health insurances are expensive, when they lost jobs and they left, my patients, they left out of state, they said, Dr. Grover, we really need your input. We can't afford private pay, and our insurance out of state is not going to cover your sessions. Please do something for us. So that was my main goal. The reason why I opened my YouTube channel was for such people who left the state and who went out, and still they need my input. So for them, I am doing this work free of cost. They can watch me, they can see me, and they can even throw questions over me, and I can help them and I can support them without spending much money over me. So, but social media, positives and negatives, yeah, it's something like fake news, like the AI, the way they work. I don't know. It's they over proportionately, they blow off things that, okay, so she is narcissistic because she has this and this and this. No. This is not. This is not an opinion.
Well, listen, your YouTube channel is excellent, Dr. Sumit Grover on YouTube. It's excellent content. It's very educational. There's incredible testimonials on there that you're getting too. So people love the content. Please subscribe. So the challenge for you, without getting too much into your practice secretly, to get someone to open up in your office, to understand that they're needing help, is a challenge for you, is it not?
Yeah, it is. But then we work side with the psychiatrist too. Because the MD psychiatrist, because I belong to this town, I'm practicing since 15 years, sure. And the psychiatrists who are practicing, they're also practicing since 15, 20 years. So they know that for what kind of patient needs to be sent to Dr. Grover. So we work together. right? So we do have referrals from outside, and they know that all the borderline personality disorder cases, Dr. Grover is the answer. So even the ECMC is connected with us.
Excellent.
So for us, it's the doors are open, of course, but then out here, when you started with it, that it's a non-medicated clinic, and our treatments, is therapy. But still, in some cases, severe depression or severe anxiety, we have to refer them to the doctors for medication.
Yeah. So, do you offer exercises or therapies when this is happening at home or in a situation or in a discussion? What kind of tips or advice could you give someone with personality disorder when they're not in your office? When you're out at home, can you do this or do that, and do they accept that?
Yeah, they do. We do it in the clinic. I practice it in the clinic. I make my patients record my voice in the clinic when we are practicing it,
great.
so that they can switch it on back home, and it's easy for them. There are so many mindfulness exercises in which I am speaking and they are recording, and they go back home and they practice it. Because if they are coming back to me once a week or once in 2 weeks, I try my level best that they don't forget about Dr. Grover, because and they don't, because they know they are going to come back the next session, and Dr. Grover is going to ask me this question, that did I practice this or not. So they do practice it back home too.
Do you see some patients with these disorders, they treat just an individual or a partner with that attitude, or is that just the way they live and think with their job and with everybody else, or are they just that way with a certain individual or their spouse or their mother or their father? Do you understand?
No, I think when the personality disorders come in, yes, with borderline personality...
They carry it with them everywhere throughout their job.
They carry on with them everywhere, but with borderline personality disorder, the specific one of the criterias and one of the symptoms is finding hard to maintain and sustain relationship. Okay. So the disorder will be carried, but the relationships will change.
Okay, you're certainly carrying that along, short stint relationships and nothing. I see. Well, I'd love to wrap things up. I have seen some of this in my experience as a former professional athlete, and I feel like it's common, and I don't know if you've seen or treated athletes, but maybe in your research, you kind of see this trend maybe as athletes become more successful. Or maybe it's at the end of their career, and perhaps it's some depression that's come into order, a relationship, a controversy, drugs perhaps. But you kind of see this in the world of athletes. I mean, would you agree? Would you have any advice? Or
yes, I will agree to that, but because you introduced me before, I'm going to introduce you today on your channel and my channel. This is Joe, and he's a former boxer, and he reached to the Olympic level of being a boxer. So even when I met you, so I have the same question for you. You have been part of the sports system. What would you like to say? What is your research? Did you ever notice that when the person is reaching to a high pedestal, to that Olympic level, did you see anything in the athlete that the narcissism is coming out, or it's my way or highway? Can you share your experience here with me? I will do research right now.
I'll tell you, Doctor, speaking on my experience, in my journey, in my story, I could admittedly say that I could identify a few examples of my life where I did experience that, and I did have some narcissistic behavior. Is it a trending thing? Is it chronic? Is it something that I lived with or needed to be treated for? I don't think so. But I could certainly look back on some things that I regret doing or regret saying because, geez, that was some narcissistic behavior. So, and I don't think everyone probably has experienced that. Now, later on in my career, and my career did end in a head injury. So, and I think that, there's a lot of talk about CTE in the NFL and NHL and boxing and the hits that we take to the head. And there could be some relationship to that later on in the road to experience some characteristic changes, some depressive changes. So I certainly do see a marriage, a tie in there, and some relationship with it. But I just find that it's more talked about today. I think, like we explained, through social media, through the more education, more clinical information, because what's happening to athletes, and more availability through Google and social media and AI, whether you're an athlete or not. So, but I think that's why I brought up the question. I mean, we're hearing about narcissism so much now, and personality disorders, and they've got a medicine for everything, and we're seeing the TV ads.
But coming back to sportsmanship, and sometimes I'm sure it must be hard for you to differentiate the actual narcissism and drug-induced psychosis or drug-induced grandiosity. That is also something which is very common in people who reach to a certain pedestal. But treatable, of course, and sorry to hear that you had to come out of your boxing profession because of head injury.
Well, it all happened for a good reason. I'm here and I'm happy and I'm with you.
For a reason.
And I'm here and I've gotten to meet you.
Yes,
but,
sure. Everything happens for a reason.
Yeah,
right?
We've learned a lot today, so I want to thank you for joining us. And again, please jump on YouTube, Dr. Sumit Grover, for some excellent content. And you can get your free consult with her on Maple Road. And thank you for joining us.
Thank you very much, sir.
Thank you.